This from Mar.
I also have the MAR out here outside of the room. So I'm starting outside of my patient's room and looking over her chart. So I have Joanne Peterson, 121047. She has no allergies. She's a high fall risk and a full code. She was recently admitted due to dehydration, and she had a fall. Her past medical history includes hypertension and asthma. She did not receive any broken bones or anything from that fall. She is on a few medications. Furosemide 20 milligrams by mouth daily, and albuterol inhaler 2 puffs is needed for shortness of breath, as well as acetamin 500 milligrams as needed for her pain. She's 145 pounds, 5'4". All of her vital signs look pretty good, as well as her head to toe assessment. Breast sounds clear, normal bowel sounds. Skin looks good. She's alert and oriented. And again, she has a high fall risk and no broken bones. So I'm just gonna take a look at her MAR here. So like I said, she has the furosemide, albuterol, and acetaminophen, and she does have 2 that could be given now. She has the influenza vaccine, which is unknown of last administered, so I'm gonna go in and chat with her about that, as well as heparin, which was admitted yesterday, so we could be given that. So I'm gonna go into my patient's room and just talk to her about these medications. Knock, knock, can I come in?
Mm-hmm.
Hi, I'm Lily. I'm going to be your nurse today. Can I get your name and date of birth, please?
Joanne Peterson, 121047.
Okay, and I see that on your wristband as well as the MAR. So, Joanne, how are you doing today? Are you feeling okay?
Yeah.
Okay. So, and do you have any allergies?
No.
Okay. So, I was just looking over your chart, and I saw that there are 2 medications that we can be given to you. We have the influenza vaccine. Have you had this year yet?
No.
No? Okay, so we can give that. Is that something you would be interested in?
Yeah.
Okay. And just some side effects to note about that. You might just have a little pain, redness, irritation at the injection site, which we'll probably do in your deltoid if that's okay with you.
Mm-hmm.
Okay. As well as maybe a little bit of fever, but we're going to be monitoring you. And then we have heparin here, which was last administered yesterday, and this is given for thrombotic events like deep vein thrombosis and just to prevent any of those things. So this can be given now as well, which we usually will do in your belly. Is that where you usually get that?
Yeah.
Okay, so we'll stick with that if that's okay with you. And so yeah, we have those. You have no allergies. Have you had any reactions to vaccines in the past?
No.
No? Okay, so no side effects to worry about there. All right, I'm gonna go get those medications ready for you and I'll be back in. Do you have any other questions for me?
Mm-mm.
Okay, so I'm doing hand hygiene. Bed's in a low position. Rails are up and she has her call light. Going out to my med room. So we're gonna start with the flu zone vaccine. So I'm just gonna look at my bottle here. The color looks good. There's no sediment or anything in the bottle, and the expiration date is good. And while I'm at it, I'm just gonna check the heparin as well. So solution looks good. There's nothing like leaking, no sediment, and the expiration date is good. So I'm gonna start with my influenza, and I'm gonna do my first med check. So I have Joanne Peterson, 121047. We have flu zone, dose 0.5 milliliters, 0.5 milliliters, given intramuscular injection. It has not been given this year, so it can be due now. And the right indication is because she has not had it yet. So I'm just going to put my gloves on and start getting this ready, and then I'll do my second check.
Now that you have some of that morphine in the system? Yes. Okay. What would that pain rating be now? Either 2 or 3. Okay.
Goodness. Okay. All right. So I'm gonna start by making sure to wash off the top of this vial because it's multi-use. So we want to make sure that's really clean with an alcohol prep pad. And then while that dries, I'm going to get my syringe ready. So I just have a Luer lock syringe here. ready. And then I have my blunt cannula, which we will open as well. Maybe. And while I'm doing this, that's having some time to dry. So I'm going to attach this onto here, throw this away, and then I am going to take this off. And it is 0.5 milliliters, so I'm going to give myself 0.5 mils of air. And I'm going to inject that air into my flow zone. And then I'm gonna pull back that same 0.5 milliliters. Just gonna get these air bubbles out. Okay. As you can see, I have 0.5 mils, and I'm just making sure to flick out those bubbles. Okay, and then I'm gonna do the one hand technique here to cap this. And then I'm going to do my second med check. So I have Joanne Peterson, flu zone, 0.5 mils, 0.5 mils, as you can see, given intramuscular injection, intramuscular, it is due now, and the indication is because she has not received it yet. So now I am just going to find my right needle. So I have the right one, so we have a 25 gauge 1 inch, and intramuscular can be 22 to 25 gauge, and usually an inch to about 1.5 inches. So I'm gonna get this opened up.
Common side effects are feeling some drowsiness,
And then
but
we're
a
gonna
very
take off.
big concern could be what are
Here.
called cardiac arrhythmias, which is when your heart
And we're
is
gonna
beating
put on our needle.
So if you're feeling any chest pain or
Perfect.
your heart's beating too
Okay,
fast,
and then
or
we're gonna make
out of
sure to
control,
label our needle, our
and I would
syringe.
stay with her, and I would do my documentation of my med pass.
Okay, so I'm just gonna label this quick.
Dispose of everything, perform hand hygiene, and leave the room.
Flu zone 0.5 intramuscular for Joanne Peterson. Okay, so I have my syringe labeled. I can take these gloves off for now.
Yeah, I know for sure. I did for a second. I feel like
Okay, so I'm gonna take my labeled syringe, as well as a Band-Aid, alcohol prep pad, and I'm gonna take this so I can do my third med check. Knock, knock, knock. Hi, Joanne, I'm back. Can I get your name and date of birth again, please?
Joanne Peterson, 12/10/47.
Okay, just checking that on your band. That looks good, and it looks good on the MAR. So, Joanne, I have this influenza vaccine here for you. And again, we're gonna do that right in the deltoid because that's a good spot for you. This could also be given in the vastus lateralis of your thigh or the ventrogluteal, like by your hip region. But I think the deltoid will be great for you. I don't anticipate any side effects or anything, but we'll be monitoring you, so let us know. And I'm just going to do my third medication check over here. So I have Joanne Peterson, flu zone, 0.5 mils, intramuscular injection, It is due now, and it is indicated because she has not had it this year. So we have our third med check there. And I'm just gonna make sure I have everything I need. And I would have just like sanitize my hands again before doing the injection to make sure my hands are nice and clean. Those would be in the garbage. Okay. All right. So I am going to just cleanse your deltoid here with the alcohol prep pad. So I'm gonna find the bone and I'm gonna go 3 fingers down. So right about here. And just pretending this is my garbage. I'm gonna start from the middle and go to the outside. Okay. Garbage. And then just looking at my label again, make sure I have everything good. I'm gonna take off my cap. And again, just check that I have the right amount, 0.5 mils. Okay, Joanne, so if you want to look away, that sometimes helps, but I'm gonna inject this into your deltoid now. So I'm gonna do the Z-trap method and hold the skin. And then I'm gonna inject this at a 90-degree angle. And then I'm gonna let that go so the skin goes over that hole. All right, how does that feel?
Good.
This is gonna go in the sharps. Okay, so I'm just gonna put a Band-Aid over this for you in case there's any bleeding. All right, and then I'm gonna come check in on you in a little bit and make sure everything's going okay. I'm just gonna take my garbage with me. Okay, bed is in a low position, rails are up, and she has her call light. And then I would go back in and check on the patient, and I'm gonna stop this video now and do my sub-Q injection next.